Hello, I'm Amy Albritton, one of the Senior Vice Presidents for Memorial Health System. I'm here today with Dr. Raj Govindaiah. Dr. Govindaiah is our health system's Chief Medical Officer, and he has been a key leader helping drive our organization through the COVID-19 pandemic. I asked Dr. Govindaiah to join me today for our COVID-19 conversations with all of you, our community, to help further explain what's going on in our community, in the organization, and really all around the world in terms of COVID-19. So thank you for being here, Dr. Govindaiah.
My pleasure. Thanks for having me, Amy.
Glad you're here. So here's what we're going to talk about first. You have a responsibility for the medical care and working with the medical staff throughout all of our 5 hospitals, as well as through all of our ambulatory practices. What would you say are some of the key steps that our health system has taken to prepare for the situation that we're in right now?
Yeah, one of the key things we had to do, 5 hospitals, over 70 ambulatory sites, serving 10 primary counties. We really had to figure out how to get ourselves organized and make sure we're doing things in a similar way. So the organization was really important, and our hospital incident command structure help provide that framework so that we could all come together and get organized. So what have we done? Well, we had to think about the experience of a patient and how we need to walk through every moment of that experience to make that patient feel safe and secure, while also protecting all of our colleagues, 9,200 of them, and our 2,000 plus medical staff members, to make sure that not only are the patients safe and secure, but our colleagues and medical staff are safe and secure, and ultimately our facilities are safe and secure. And this is so important because we needed the ability to be able to take care of you now, and a week from now, and a month from now. And so how did we do that? Well, we started in little steps, and as we learn more, we've done more. One of the key steps to making sure our facilities are secure, whether it's the hospital or an ambulatory clinic, is to identify if people have COVID-19 before they ever come into the hospital. So if you're coming in through the emergency room, we flag you down right outside and say, and ask you a couple of questions, and either send you right back to the emergency room or send you to an outdoor triaging area. And then we identify, hey, how much risk do you have for COVID-19? And based on all of these things, we then take additional steps. Amy and I are wearing masks today. Every individual in a Memorial Health System healthcare facility, somewhere where patients receive care, every individual is wearing a mask now. This is to protect every other individual in that building. And you're going to see pretty quickly, I think the governor is going to announce that everyone in a place of work needs to be wearing a mask. And so we've taken these steps, but we did them several weeks ago. Every person coming into the hospital is checked on a daily basis for temperature and if they have symptoms. So we get a dot every day. Today's Friday, the dot is black. Yes. So I have a black dot on my badge because I'm screened just like everyone else. And if you're a patient, you're screened. If you're accompanying a patient, you're screened. Now, one of the things we've unfortunately had to do is limit the number of visitors in the hospital. This we don't like to do. We want patients to have people here to support them. But we have to prioritize safety first. Limiting visitors is not new. Limiting visitors as much as we have is a little bit new. Every year during flu season, the Illinois Department of Public Health says when there's widespread flu activity in the community, to limit visitors. Well, we started that back in December, and we never really lifted those restrictions, and unfortunately had to get more restrictive. So how are we doing things to keep people safe? Controlling the environment, making sure people are checked before they come in, putting people in masks, and then for all of our caregivers, all of our colleagues, everyone interacting with the patient, we've created these nice, easy to read tables that they can go, what sort of situation am I taking care of the patient? What am I doing? What do I need to wear? Do I need a mask? Do I need goggles? Do I need a respirator? That's that N95 mask that all of you have heard about. So safety is our first and highest importance. It's what we want to do for everyone in the hospital, whether you're a patient, you're accompanying a patient, or you're trying to take care of that patient.
So one of the things that you said there that's really important is as we've learned more, we do more, right? Because we know this virus is not very old. It's a novel virus for a reason. And so the guidelines and everything that we're doing keep changing as people learn more and more about the virus. That's a bit of a different situation for all of us as individuals and people in the community to get used to and to understand. So we appreciate you explaining the masks. I think that's helpful, especially as the governor's announcement about the expectation of people wearing masks out in public. But the idea there is really focused on the mask is not to protect you from getting it from someone else. It's all about source control, right? So can you explain that a little bit more to people?
Yeah, so there's a couple of reasons you need to wear a mask. I'm going to start with the healthcare worker. So the healthcare worker, a doctor, a nurse, even someone delivering food or cleaning your room, right? They are exposed to lots of people who are sick. They wear the mask, the gloves, the eye protection, the gowns to protect them from sick people, okay? So that's a medical grade mask. Why do I have this on? Because sometimes during the course of my day, I go and visit different care units where they're providing care for COVID patients or non-COVID patients. So that's for the healthcare worker. But the recommendation that all of us wear masks, Amy is not a healthcare worker, but she's wearing a mask. Phil, our cameraman, is also wearing a mask. He's not providing direct care to patients. Why are they wearing masks? Well, the mask also prevents someone who's sick from coughing and spreading the coronavirus. So the reason to wear masks is a little bit different. Wearing the mask when you're out and about protects everyone from you. If you're sick, you may not have symptoms or you may not have developed symptoms. So that mask is to protect everyone from you. In the hospital setting, when you're providing care to patients as a healthcare worker, that mask is to protect you from all the sick people that are in the hospital. So different reasons, different uses for the mask. And the idea of the people in public, like me, if I go to the grocery store wearing a mask, that's really what's evolved over time. Because I think if you were to go back to March 1st, people wearing masks out in public would have been looked at like they had a third eye. And now, if you don't wear the mask, you might start to feel a little uncomfortable because the expectations have changed as we've learned and adapted. And we're going to have to keep learning and adapting because we're not over the hump yet.
Very good. So one of the questions that we hear a lot about, and part of this comes from the governor's press conference every day, they discuss how many ICU beds are available and then how many ventilators are available. So could you explain to our community the difference between a general patient care bed and an ICU bed? And do we have those in all of our hospitals? And how are we doing in terms of our ICU beds?
Right. So Memorial Health System, 5 hospitals, serving Central Illinois, Memorial Medical Center here in Springfield, Decatur Memorial Hospital in Decatur, Passavant Area Hospital in Jacksonville, Abraham Lincoln Memorial Hospital in Lincoln, and Taylorville Memorial Hospital, obviously in Taylorville. These hospitals range from Memorial Medical Center with 500 beds to Lincoln and Taylorville with 25. Across the health system, on a normal day, say last fall, we were taking care of around 650 patients. That number's lower now, right? Because less people are coming to the hospital right now. But to prepare for the possibility of more patients because of coronavirus, we've looked at every place we could put a patient. We've looked at how we would care for those patients. And we've looked at what sort of things do they need. And we think that with all of these creative ways we could find places to take care of patients, that we could double that number of patients from around 600 that we normally take care of to to almost 1,200. Now, it'd be a very different experience, right? If you have come in the hospital and been in a private room, if we have 1,200 patients, there are no private rooms, right? But if you need care and this is the only way you can get it because there are so many people sick all at once, I don't think you'll care. I don't think you'll mind. I think you'll be thankful that we as an organization were able to flex and find creative ways to take care of you. And hospitals across the country are doing this. When we think about our ICU beds across our hospital system, that's closer to maybe 75 to 80. But we figured out we could use other spaces to take care of critically ill patients in the ICU. People who need more support, either for their breathing or for their blood pressure. So we've had to get really creative, but that's okay. Because if people need care, we want to be able to provide it to them. And now we have a plan of how we would do that. And that's all something that's pretty new that we've never had to think about in the past. We've thought about, if there's a tornado, how we would take care of 200 people that showed up in the emergency room. We've never really had to think about if we had double the normal amount of patients for a month. But coronavirus has made us think about it. And we have plans that we're ready to execute if we need to.
So one of the things you mentioned is that if someone is in the intensive care unit because they need that additional help with their breathing or with their blood pressure, the community's been learning more and more about ventilators. Can you talk about a ventilator, what it's used for, and how it helps in the care of the COVID-19 patient?
Right. So COVID-19 patients, this is a respiratory illness, so it affects the lungs. And, there's a lot of illnesses that affect the lungs. And so oxygen is a therapy we use quite frequently to support people. And many of you may have heard of a CPAP machine. This helps you get oxygen at night. And a CPAP machine is not really a ventilator, but there are other machines that are a little bit more complex that work kind of similarly to a CPAP, but these blow air in and out. And some of them require us to put a breathing tube down. Typically, we do this when someone has a really bad pneumonia, or if you've had surgery, you might have had a breathing tube down. And so we look at all of these ways to support people, and when they have a really bad pneumonia, we put a breathing tube down, and we connect you to a ventilator, which does the work of breathing for you until the infection gets better and you get stronger, and we can get rid of all that stuff. And the concern is a lot of people coming in with respiratory illness all at once. They all need a ventilator all at once. And how do you manage and juggle that? Thankfully, we have not run out of ventilators. We have plenty. And we have plans on how we would manage a surge of patients. Again, just like the regular patients, to about double of what we normally do. So I think we're building ventilators across the country, but most of those have not made their ways, have not been deployed to the places that need them most. And thankfully, Central Illinois right now doesn't need extra ventilators.
That's good. So question as we start to think about the idea, you said we could get to a point where we would be able to care for 1,200 patients if we needed it. That would certainly mean more people in our community needing that care. And what we talked about is the idea if we moved into a phase called community transmission. And you've been telling us as our CMO that we've been in community transmission for a while. Can you explain what community transmission means? How do we know that we're there? And what is that impact then on the organization?
Yeah, so community transmission is where you're getting infected by someone else in the community. And if you think about how this disease came here, it came here because of someone who traveled, right? It didn't start here. It started in China. It moved around because this is a highly contagious disease. And travelers brought this back. And actually, it looks like people who traveled to Europe brought this back, and that people in Europe got it from people who traveled, and eventually you follow that chain all the way back to China. So how did it get here? Well, people from Chicago or St. Louis or somewhere else, or people from Springfield traveled outside and brought it back here. And now it's circulating in our community. So someone gets infected by someone else. Sometimes it's someone at work. Often it's someone in their household. That's some of the first cases we saw were father, son, husband, wife, whatever it might be. But now it's circulating in our community. And one of the things that makes us really concerned is there's certain areas of our community that are more vulnerable. And these are group settings where people live really close together or work really close together, and they can't avoid each other. And an extended care facility or a jail or certain manufacturing plants are great examples of that. And so now you go to work, you sit next to somebody, or you work next to them, and they get you infected. And that's community transmission, where it's out and about in the community itself. So that rate of community transmission is really important. If transmission happens quickly, all of a sudden a bunch of people come to hospitals all at once. And that's why social distancing's been so important, to slow down that community spread. And we've been really effective in central Illinois because we have all this farmland around us that separates us from Chicago and St. Louis. It's almost like a moat. It's a defensive wall. But we do still have activity within our community, and we still are watching that very, very closely.
So when we look at this idea of people saying, well, can we finish up this stay-at-home order? Did the governor really need to extend this? It's not that bad here. We're not experiencing what Chicago is. What is your response to that? Because we actually saw, we just came out of our leader meeting, and we actually saw that today, not only did Illinois experience its highest case ever, our hospitals, excuse me, my mask is slipping down here, our hospitals actually have the highest number of inpatients right now at this moment than we've had this entire time. And we know that to be true about the other hospitals within our region. The community is having a little bit of a disconnect, right, with that. So as a physician and as the chief medical officer for the health system, how do you help the people understand that a little bit better?
Right. So today, Friday, we have the highest number of new cases in the state of Illinois. And we have the highest numbers of patients in Memorial Health System hospitals. We have the highest number of patients hospitalized in the 2 hospitals in Springfield. So what we're feeling, in my sense, and I'm feeling it too, right? What we're feeling is really we're a couple weeks behind some of these other large metropolitan areas like Chicago. Our numbers are not going down. They're actually continuing to tick up. And one thing to remember about the peak, that's the date at which you have the most new cases, okay? And so when you have the most new cases, those people don't get better for 14 days. So the actual peak of the actual number of cases occurs a little bit later. Because if I've got the most new cases of 100, and the next day I've got 90, and the next day I've got 80, I'm still adding on, and people aren't recovering. So the strain on the healthcare system actually happens a little bit later. Now, thankfully, neither of the hospitals in Springfield are anywhere near capacity, and we're more than able to take care of this. But that's why you hear the governor saying, well, the peak might be in mid-April or mid-May. And let's face it, there's a little bit of educated guessing going on here. And so I'm not going to promise you that anyone can predict the future, but if you were to go back to May 1st, I don't think anyone was really predicting this. So for all of you wondering, well, we don't see the sick people, I'll tell you, they're out there, and we continue to see them here at the hospital. And all of the things that you do for social distancing have made a huge impact in reducing the number of patients that we're seeing here in the hospital. And I ask you to continue doing that important work.
Yep. It's a very good point, because we are where we are because of the practices that were put in place early on.
Yeah, without those, we would have had far more patients
Yes.
and far more people in the community.
Yes. So, and I think you've made such a good point, is that because people aren't seeing it, or their family isn't directly impacted, or they're not seeing some of the stuff that's comparable to what they saw in New Orleans or Detroit or in Chicago on the news, you know very well, you're in our COVID-19 units, you're in our ICUs, you're talking telephonically with the families. This is real, right? This is very real. Yeah.
So yeah, it's absolutely real. We have patients here at Memorial. Some of them have passed away. I wish this was was just a scary bedtime story, but it's not. There's sick people in our community, and your actions can help prevent more sick people from happening in our community.
So Raj, one other kind of myth busting that I think would be helpful from you. We hear a lot of people in the community who will say, well, X number of people died from the flu and only X number of people have died from COVID. Why is this any of a bigger deal? Why are we so focused on COVID-19? I know you hear that a lot, and you've had a lot of conversations. Given the opportunity, how do you explain to people the difference between why we have to treat this differently than the flu?
Yeah, absolutely. So the first thing is about the flu. The CDC every year comes out with estimates on the number of people who got the flu, who had doctor's visits, and who died from the flu. But these are estimates. And what are they estimating? They're taking the actual number of diagnosed cases, and they know that not every case is diagnosed, but they have 50 years of data on this. And so they go, well, we only diagnose, let's call it half. So if we diagnose half the cases, then there's another half of cases we didn't find. And that's how they estimate it. So their estimate, and the flu season isn't really done until mid-April, their estimate this year was somewhere between 30 and 60,000 flu deaths. All right. Let's take that number and put it aside for a second. Already in the United States, we are nearing 50,000 deaths from COVID-19. And that's not an estimate, that's an actual number of deaths. So more people are going to die, more Americans are going to die because of COVID-19 this year than the flu. Now, why is that? The flu is bad. COVID-19 is bad. What makes COVID-19 exceptionally bad is because none of us have immunity. None of us have ever been exposed to it before. So we don't have antibodies, we don't have treatments, we don't have a vaccine to prevent it. And that's what makes this so bad. The other thing to remember about the flu is we had, let's call it 50,000, just to make it easy, 50,000 flu deaths in the last year. And that's after 2/3 of Americans got vaccinated. What happens if those people don't get vaccinated? So you had to have more deaths because you'd have more illness. Well, there's no vaccine for COVID-19. None of us have seen it. It's a pandemic because it's spreading widely in our communities across the world, and because it's new. And those two things make it incredibly dangerous. We don't know how to treat it as well as the flu. We don't have medicines, and we don't have a way to prevent it, like with a vaccine. So the best prevention is all the things we're doing: wash your hands, wear a mask, socially distance. And until we get treatment, that's what we're going to have to do.
Okay. So as we look at this idea of we're treating a lot of focusing a lot on COVID-19 patients, but I've heard you say as a physician, one of your big concerns right now is that people who need care for other reasons, whether it's a stroke, a heart attack, a mental illness, that those individuals are avoiding coming to the hospitals because they're scared of getting COVID-19 when they come here. And we've actually seen some really unfortunate cases in our community where people who they avoided care, they didn't come and get it fast enough, and that was detrimental. So what can you share with our community about seeking care and the safety of what we're doing here to protect them if they needed to come here.
Yeah. Earlier this week, I was talking to one of our cardiologists and one of our cardiothoracic surgeons. They do open heart surgery. We had a gentleman who, early 60s, less than 65, who had chest pain for days and was afraid of coming in the hospital. And by the time they came here, they were extraordinarily ill. And this man died. And it's a horrible and heartbreaking story, because he did not die because he had COVID-19. But I fundamentally believe he died because of COVID-19. He wasn't sick with it, but he was afraid to get the care he needed and waited too long. And by the time he came in, there was nothing we could do to help him. And so the thing I need everyone to understand is hospitals existed before COVID-19. Doctors existed before COVID-19. And we were doing a lot of things to help a lot of people. And if you need that care, you need to get that care. And if you wait or say, well, I'm worried about COVID-19, well, we can't help you. And we're ready, willing, and able to take care of you. And we put in every protocol possible to make sure that the hospital is safe for you and everyone that provides care in the hospital. So do not worry about that. Come here and get the care you need. It's so incredibly important.
It's a very important message for our community to understand. So last question for you, Raj. We are now ending our 7th week of our hospital incident command structure in this COVID-19 pandemic, and a lot of work going on. You know, all of us are spending a lot of hours, a lot of time here. I imagine you're seeing all of us as colleagues than you are of your family and both of your girls and the dog. Your wife is a physician also, so you have some duality there in terms of what's going on in your household. What advice do you have to help people manage that side of things, right? Because life at home is very different too. Thoughts on how things are going for you and your family and what others can do to manage through this time?
Yeah, no, I'll tell you, the happiest person in my family is our dog. The dog walks several times a day, belly rubs all the time. She's super happy. My girls, I have 2. One had a birthday a few weeks ago, and I think that's when it became real for her, because she wasn't going to have the birthday that she wanted, because she just wanted to spend time with her friends.
13, right?
Right.
That's a big deal.
13.
That's a milestone.
And she really missed them. She wasn't upset about all the other stuff. She gets it. We have conversations all the time. But she misses other people. My older daughter, she has watched 40 movies. I don't know how that's possible. I don't know what she was doing before COVID-19. So everyone's finding different ways to occupy their time. One of the things we're trying to do at home, and I need to do a better job of this, but is I really want all of us to cherish this time that we have together. Being together as a family, super important. So what are we doing together? Well, we're watching movies together. The process of picking a movie that 4 people want to watch together has been interesting. We're playing board games. We're making puzzles. I'm gaining weight because my daughter is making cookies every single day. But we're doing things together, and we're eating dinner together, and we're appreciating each other. And I hope all of you have the same opportunity to do that with all of your loved ones as well.
Okay. Well, thank you, Dr. Govindaiah. We really appreciate you being here and sharing all of this insight with our community. We will be back next week with another COVID COVID-19 conversations, and we're going to focus on some of the relationships and collaborative efforts going on in our community with the other healthcare providers, as well as with all of the state and county agencies. So we'll be hearing from Dr. Graham, who is serving as the liaison officer for our health system during this COVID-19 pandemic. Thank you for taking the time to watch today, and we really appreciate it. Continue to social distance, wash your hands.
Yep.
Right?
Thank you, Amy, and thank you for Springfield and Central Illinois for tuning in. One last thing I've got to say is there are a lot of healthcare workers. They're coming to work. They're doing things in a pretty uncomfortable environment, and it's a little weird, right? Because they're going to work and everyone else is staying at home. But your support for the people at home, your support of them so that they can get up every day and come and take care of people in the hospital or the respiratory clinic or through a telehealth visit, it is so important. So thank you for supporting every healthcare worker, especially those that live with you or are in your lives. So thank you very much.
Thank you.